Texas says its measles outbreak is over, but the start of the new school year could mean more cases. The latest data in North Carolina shows Durham students are among the most at risk. WRAL health reporter Grace Haba asked a pediatrician if the measles is a legitimate threat for these students.
This is the statewide kindergarten immunization dashboard. It's updated by NCDHHS. Now, the darker a county's shade, the more students are up to date. And it's this lighter shade here, Durham County, that a pediatrician says is cause for some concern.
It's a little shocking to see that, kindergarten readiness is lower than you would expect. Teenagers are maybe not as well vaccinated as you would expect.
Compared to surrounding counties, Durham has the lowest vaccination compliance rate at just 88%, according to the most recent state data from 2024. Wake, Chatham, Orange, and Johnston counties are all much higher in the 90s.
Kids are not above 95% in a particular school.
Yeah.
What is the risk there?
So it's, with measles, that's the real concern. It could turn up like that, and it's so contagious. It could just rip through a school, before you had any opportunity to contain it.
With more than 1,300 measles cases reported this year, including in North Carolina, Dr. Moody says MMR should be the #1 vaccine prioritized for students heading back to school.
Certainly, we want kids to be immunized, diphtheria, tetanus, because that's a foundational thing. I think making sure they get their polio and Haemophilus influenzae, very important, not because we're seeing polio here, but it is something that could easily come back.
Moody also advises parents of teens and preteens to talk to their pediatricians about meningococcal and HPV vaccines.
We're all shedding things. We know that when you bring people together, they will start passing them around, and then any of the susceptible individuals can potentially come down with it and get sick.
Dr. Moody says he does also believe in an annual COVID and flu shot, but says right now, any child not up to date on that MMR vaccine should again really be making that vaccine a priority. Grace Haba, WRAL News.